everyone, I'm Tram Mai. Measles is one of the most contagious diseases, and cases in the U.S. are climbing again. So far this year, we've seen more than 500 confirmed cases across more than a dozen states. A majority of those are in kids under the age of 19 who are unvaccinated or have an unknown vaccination status. This map from the CDC shows where those cases have popped up. More of the cases in 2026 have come from 2 outbreaks along the Utah-Arizona border and in South Carolina. South Carolina has the largest measles cases in the country right now. Data from the state's health department shows case numbers exploded in January. It has confirmed more than 800 cases since the first case was reported in the state in October.
This area is like one of the top outbreak areas. I think any parent is concerned about a sickness or anything that's viral, especially that kids can contract, but I don't really have like high concern, I guess you could say. My kids are vaccinated and I believe I've done what I can to, take care of them.
If you're going in a public place like church or a store and your kids are sick, be mindful of the people around you. I mean, it should be common courtesy that you don't impose that on other people.
I know that I was vaccinated. I know my daughter and my little granddaughter were. My concern is my husband doesn't remember and he's older, and that's a concern. I'm not panicked. I feel that people in my age group, we were all vaccinated.
Measles hit the U.S. hard last year with 2,200 cases across 44 states. It was a record and the highest we've seen in decades. There were 49 outbreaks across the country, the biggest one in Texas. It accounted for more than 700 of those cases, and 2 children there died. Cases in South Carolina have now surpassed the total cases Texas saw during its outbreak last year. Many of the cases are focused in the state's northwest, with the outbreak centered in Spartanburg County. It's quickly grown in recent weeks. Hundreds of children across dozens of schools were quarantined because of measles exposure.
South Carolina has been a hotspot for measles starting in October. And this is an outbreak that grew very slowly through the fall. And then after the winter holidays, absolutely exploded in January. There are a couple of factors that are leading to this. Number one is in South Carolina, as has been the case in communities across the United States, there has been declining numbers of people who are fully vaccinated against the measles virus. This is a virus that is highly contagious, but the vaccine is extremely effective. But there have been pockets of communities where the vaccination rates have fallen below 95%. That's a key number that the CDC and other experts say is needed to prevent the sustained spread of this virus in local communities. And so one of the things experts look at is the vaccine rates in individual schools. And in the areas around Spartanburg County, which is in the northwest part of the state of South Carolina, there are many schools that are below 90% and some as low as in just 20 to 25% coverage of their students with the measles vaccine.
Autumn Bracey has more on how health officials in South Carolina are responding.
Dr. Linda Bell with the South Carolina Department of Public Health says the agency is doing everything it can to get the high transmission of measles right now under control. With cases continuing to rise, leaders with the South Carolina Department of Public Health say vaccinations are critical to helping bring those numbers down.
Understanding what leads to hesitancy to getting that protection is what we want to continue to understand, and we do this through outreach in various ways.
The South Carolina Department of Public Health launched a measles dashboard that provides data, including cases by county and by confirmation week. The agency is performing contract tracing as a key method to monitor cases and help prevent further spread. They're also working closely with the CDC to respond to the outbreak.
From their experience with supporting through other outbreaks, and so how effective outreach has been, the means of outreach for sort of isolated communities.
After this past year of continuous outbreaks, experts now warn the U.S. is at risk of losing its measles elimination status. It's something we've held on to for 25 years, since measles was declared eliminated here back in 2000. It's a technical designation and is mostly symbolic. It's given to countries that have gone a year without a continuous spread of disease. International health authorities say they plan to review the U.S. measles elimination status in April. Our station in Seattle spoke with a doctor to learn more about how measles outbreaks can impact communities.
Well, measles, we know, Joyce, in places just north of Seattle, but across the country, really tends to run and cause very significant outbreaks that can disrupt a child's in-person school learning, can disrupt communities and their well-being. It can overwhelm children's hospitals across the country. And what we're seeing is zip codes that have less than 60% vaccine uptake rates for the measles vaccine, which means that those zip codes, those communities, are incredibly vulnerable to measles outbreaks because this virus is incredibly contagious. One person can infect 10 people around them, especially if those individuals are also unvaccinated. So this is a very serious situation because we haven't really had this level of vulnerability, Joyce, in the country, and certainly in specific communities like South Carolina. We're seeing 800 cases just over the last few months. We have never really seen this in our lifetimes before. So this is breaking new ground.
I think people probably don't understand, too, the sort of the long-term health impact or what can happen if someone gets measles because it's so contagious and they haven't been vaccinated. So what are the risks? Why should people be concerned?
Let's go through the symptoms, and it can be really confusing. Right now, we're in cold and flu season. Unfortunately, measles is a great mimicker. It can cause classically cough, coryza, conjunctivitis. What is that? Well, cough is cough. Coryza, a runny nose, conjunctivitis, pink eye. Those could be the sentinel symptoms, Joyce, after exposure for the first few days before going to that classic rash that starts at the face and then travels down to the trunk. And that's what parents need to be on the lookout for. If your child develops upper respiratory symptoms, pink eye, runny nose, don't immediately assume this is just going to go away, especially if you've been hearing about measles cases in and around your community, in your child's school. This is something to take seriously and to make sure you see your child's pediatrician to get tested. But what's the bigger concern, too, for that specific child, whether they're in Snohomish County or South Carolina, is about 1 in 5 children develop severe pneumonia from measles. So this is not something that causes self-limited upper respiratory symptoms. It's not something that just causes a rash. I think that's the confusion. It can actually cause severe pneumonia, Joyce, leading children to go into the hospital. And that's what we saw in West Texas earlier in 2025. Children's hospitals overwhelmed because of measles-related pneumonia. And I think that takes parents by surprise.
As you know, in South Carolina, we're seeing the largest measles outbreak since it was declared eliminated. And we've seen spiking cases in Texas. There's cases all across the country, I think at least 14 states. Well, how did we get here exactly?
Unfortunately, you and I have had this conversation now for about 12 months under this new leadership and regime of Robert F. Kennedy Jr. It's not hard to draw a direct line between how they speak or do not speak about the importance of vaccination and these declining vaccine rates. I mean, it is that simple. Decreased confidence, increased questioning about safety coming from him and his administration has resulted in a lot more burden on parents to ask questions of their pediatricians, not like there's already plenty to do in that 15-minute visit, child visit. Here we are adding greater confusion and asking more questions that frankly I don't think need to be asked. This is no new science here, Joyce, has unearthed itself in the last 12 months about the safety or the efficacy of this vaccine. This is self-created.
Measles spreads easily when an infected person breathes, coughs, or sneezes. The virus can remain in the air for up to 2 hours. Health officials say symptoms can show up 1 to 3 weeks after exposure. They usually start with a fever, cough, runny nose, and red eyes, followed by a rash. To limit exposure to others, doctors say call your provider ahead of time. If you think you're infected, don't just show up. Experts say the best protection against the measles is the vaccine. Doctors recommend people receive 2 MMR vaccine doses. For children, they say the first should be when they're 12 to 15 months old. The second would be between the ages of 4 to 6 years old. 1 dose is 93% effective. 2 doses are 97% effective. Now, for adults, if you were born after 1957, chances are you're vaccinated with both doses. But if you think you're not or lost your vaccination records, you can take a test and there's a booster available. Now, if you were born before 1957, you probably had it as a child, which gives you natural immunity. Unvaccinated kids are most at risk for the measles. Some may be wondering, can you vaccinate your children early? Megan Malaris spoke to an expert to verify.
Like any vaccine, the combo measles, mumps, and rubella shot, MMR, has a timeline. The CDC recommends 2 doses, the first between 12 to 15 months and the second between ages 4 to 6. So can a child get the first and second doses early? Let's verify. Our sources, the CDC, AAP, and Dr. Suresh Nagappan, head of the Children's Unit at Moses Cone Hospital. The answer is yes.
If your baby is 6 months to 11 months and you're traveling to an area where measles is endemic, that is a reasonable time to get an MMR vaccine. But then it doesn't count as one of the 2 standard vaccines that we recommend for everybody.
Meaning your baby would still need 2 more doses after turning 1.
So it's not so much that we're worried about the danger of giving it less than 1. We are just not sure it's going to work under 1. Because measles is a live virus vaccine, you still have some of your mom's antibodies in you as a baby that first year. And so what it can do is neutralize that vaccine and to make it so it doesn't work.
Nagappan notes children can get the second dose as soon as 4 weeks after the first. The American Academy of Pediatrics guidance of waiting until kindergarten is purely convenience to time it with other vaccines, since the CDC notes the first dose is 93% effective. With your Verified, I'm Megan Malaris.
An outbreak that has gotten national attention. The Department of Homeland Security has reported cases of measles at an immigration detention center for families. Officials say 2 people at the center in Dilley, Texas, have been diagnosed. This same center has been in the national spotlight in recent weeks. It's where 5-year-old Liam Cornejo and his dad were taken when immigration agents took the boy in Minneapolis. Now, with the measles cases, some Democratic leaders have called for the center to be shut down. Our station in San Antonio has more details and reaction.
There are 2 confirmed cases of measles at the ICE detention center in Dilley. Now, ICE says they would not have released 5-year-old Liam Conejo Ramos and his father if there was any risk of exposure. Both Liam and his father are vaccinated and had a full medical exam before they were released from ICE custody. Congressman Joaquin Castro had just visited the facility last week. He has been a huge advocate for Liam and his father and was supposed to visit the ICE detention center in Dilley this upcoming Friday. That visit was canceled because of the measles cases.
Congressman Joaquin Castro sounded the alarm, saying plain and simple, the Dilley Detention Center needs to be shut down immediately. The congressman posted on X Monday afternoon, saying Dilley is not equipped to fight the outbreak due to the lack of knowledge, a delayed medical response, and tight space conditions. Measles is a very contagious disease, and Representative Castro wants everyone who is not diagnosed to be moved for their safety and allow Texas medical officials to oversee care, not ICE. Castro says the families in the Texas National Guard at these facilities should not suffer in unsanitary conditions. Local State Representative Josie Garcia also posted in support of shutting down the facility shortly after Castro, saying the people inside the Dilley facility deserve better, especially when they did not break the law. On Monday, the Department of Homeland Security stated all detainees are being monitored and they're taking, quote, appropriate and active steps to prevent further infection.
We'll continue to track updates and bring you the very latest. For now, I'm Tram Mai. Thanks for watching.